Hello and welcome back to Medical Monday.
Welcome back.
Today we're going to be helping you out with a condition called a slap tear because the University of Rotterdam noted that about 67% of all people will end up with this particular shoulder injury.
Wow, 67%.
Yep.
This is more common than I thought it was.
It's very common, and we see it happen for a very specific reason. It's got a weird name. It was developed from some of the Snyder colleagues back in 1990, and it actually has it's an acronym.
Yes, correct.
This superior,
which is above,
labrum,
which is the body part,
anterior,
the front,
posterior,
and the back.
We just say slap. Just say slap. Don't worry about it.
We just say slap.
It's a tear right here in the front of your shoulder. But we get that. Why?
Why? I was about to ask the same question. I said, you know what? We get it by cocking back too far. This is very common in a lot of athletes because it's not the forward movement. It's actually going too far back. And it tears.
That force is too much coming back. It's very popular with baseball players we see here, but you see there's multiple sports with this.
Yes. It's not just sports.
Exactly. It's more than sports because we have tons of worker patients doing the same motion, and it's that cocking back motion, getting ready to go forward with such force, tears this very front portion. And this is very different than a rotator cuff tear because this one typically you don't have pain at nighttime when you're sleeping, whereas with rotator cuff, which is more the back muscles, that's where you typically see the pain at night with sleeping.
And that is a huge diagnostic factor, right? When your provider is asking questions, when you go in, my shoulder hurts, we're trying to figure out specifically what's going on, and that is a huge yes no type scenario for shoulder pain. Which one is it?
It's complicated because if you looked at the shoulder, we say rotator cuff. It's not just rotator cuff's not a muscle, it's a group. And this is how complex the shoulder is. Think about all the different ways you move your shoulder, all the multiple muscles that are involved with it. The ligaments and tendons, which are the connective tissue. There's multiple things that can be torn in here. And oftentimes we see a slap tear or a rotator cuff tear don't just happen on their own. Usually they're in conjunction with a couple of other muscle groups that have tore just because the amount of force.
Correct. And that's exactly it, the amount of force. But everybody watching, everyone is wondering, what is the labrum specifically? It's the only anatomy part in the name slap.
Yep.
What is the labrum? What is that?
It is what encapsulates, covers the joint space. This is what seats that in there so that, because in all joints there's no blood flow, this labrum is what keeps that out and keeps the fluid, the actual joint fluid, within that socket.
Very, very true. And it tears, just like paper. You can see here's a normal one, all right? But here you can see those red marks where it's tearing from that type of movement, that sudden force that you talked about.
It happens, and then the treatments that are involved in it are very important because nowadays surgery is not well off of an option because of the amount of great rehab that we have.
Correct.
Rehab is so important with this one that it's going to keep you out of surgery.
You know, and this is so true. The shoulder is one of the most complex joints in the body.
Yep.
It really is. And it's amazing to know that it's so complex that it's really because of weaknesses and compensations that exist over time from the injuries that we can just strengthen it properly and repair and help it fix itself.
Yep.
Just great. So one of the options, though, knowing that rehab is one of the best options for it, is occasionally there is the need for removing debris or even repairing it somehow. And so surgery is occasionally an option. I know you have some great stats that you probably want to share about.
Well, we look at a lot of them when we talk about the Johns Hopkins School of Medicine that only 6 to 25% of the patients with arthroscopic surgery on this get benefit. So that's part of the problem, is that with such a low success rate, we want to avoid this at all costs. You know, if we've went through great rehab, if you tried these other options, and this is kind of a last-ditch effort, you know, then it would be something to move into. But it wouldn't be a first choice for patients.
Correct. We do not want surgery to be a first choice. And hopefully if you've had this surgery, you're part of that 6 to 25%.
Yeah.
Because that's always what we want to see. the best results.
But some of the great rehab, we actually have a phenomenal rehab here where we have mirrors set up to where you can look at your motions. It's all about how we get function back in that arm. We want to have the proper function, and that's why we have mirrors set up so you can be watched not only from the team here, but then you can also watch yourself, because the rehab that you do here is only a small portion of your day.
A small, very, very small.
You can transition these to home, but you want to be sure you're doing them properly.
Yep, absolutely. And it's very important to make sure that you're taught correctly and comfortable doing it at home. The other important factor in shoulder injuries is making sure that, one, that shoulder joint itself is aligned and moving properly, but also the next closest segments in regards to movement is going to be the spine. A lot of times, even through exam processes, is it the neck or is it the shoulder? Is it the shoulder or is it the neck? We've got to rule those out. And so typically one is 99% of the time going to affect the other one in different ways. So we want to make sure that functionally as well as mechanically things are working the way they need to. And as you strengthen your shoulders, your neck as well is strengthening. So we need to make sure we align that spine and get you adjusted properly. There's lots of different techniques. The table you saw is for more manual style adjustments, but there's lots of tools to help increase blood flow, align the spine, and get the proper movement in there. Because if we don't use it, we lose it, and we want you to use it.
Yeah.
All right.
One of the big things is with frozen shoulder. We look at that, diabetes is a big driver of frozen shoulder, and we see that with tears because people don't use it. When you have a tear and it's very painful, you don't use it, and it can lead into further problems. So you want to get them corrected as soon as possible. Just like this here, this is a regenerative injection. This is to get the patient better faster. We look at the amount of professionals that have utilized regenerative medicine, whether it's Kobe Bryant, Tiger Woods.
Yep.
We look at Gronkowski. Multiple NFL, NBA level players are utilizing this because their bodies get damaged. They're doing very physical things. They got to get back out on the field. But it's not just for high-end athletes. It's affordable for you and me alike. It's not just astronomical for superstars. And this will keep you back on the field of life. Things that you want to do, get you back to work as well very quickly.
Yeah, and I love that you shared about the regenerative injections because there's a spectrum there too. Just because the word regenerative is used doesn't mean that it's, anyway, doesn't mean that it's the best of the best or the worst of the worst. There's a spectrum there. Everybody's case is a little bit different as to what's the best option. So I always love it when we share that information for everyone to know. I love it. Awesome. So that's it. That's it. I know everybody thought we were probably going to hit each other today because we were talking about slapping, but
no.
Unfortunately, we were disappointing. I'll get a slap in there though.
Slap tears occur, a part of life. There's great treatment options out there. Look around so that you get the best options for you and your choices and know what's out there. I hope you learned a lot this Monday,
Yes, very
and we
much.
will see you next